Welcome back, everyone. This is episode 28 of Lift Talk. I am joined by our resident physiotherapist in-house here at City Strength, Claudia O'Shea. Thank you for joining me, Claudia.
My pleasure. Thanks for finally inviting me on.
Well, I must admit that you were actually like the backup guest this week because
I'll just leave.
we were supposed to get Johnny Tran on to do a SPD Australia Cup preview and go over all the details of that. But he's got a sore throat and his voice is a bit shot, so I needed a backup plan, and you're obviously just in the room next door to this room, so I was going to get you on next week anyway. So
Okay, I'm glad to be your replacement.
So I'm going to start the episode, even though we were talking about the housing crisis. We're going to start it with what I start every episode with, which is your first interaction with physical culture. Do you have a first memory of like the gym space or the fitness physique world as a kid?
Honestly, not a whole heap to do with like the gym world. I think I grew up in a space where girls didn't really go to the gym. So my first interaction was probably just like being a gymnast when I was younger. And then I was kind of just doing lots and lots of sport, basically every sport under the sun in high school, but I was never really like super good at any of them. But girls, we were kind of just told to run. I went to an all-girls private school, so we didn't have a gym at my school either. So yeah, I didn't even really know that resistance training existed for females until I started my physio degree and started learning about resistance training. And I was like, hey, this thing's kind of cool. Like, it stops you from being old and frail and getting all these nasty diseases. So then I started like looking into the gym, and then I found like, oh, girls can get muscle too and not look like Arnold Schwarzenegger. And so, yeah, I started going probably in my first year of uni. And then from there, I liked lifting one thing that was heavy one time. And I was like, yeah, I really like the feeling of being strong. And so I kept kind of figuring it out myself until I reached out to your wife, Chrissy. And I got coached by Chrissy for a year before coming to you. And yeah, I guess that's my story.
So who are some of your early inspirations then in the sort of fitness space once you did discover it?
Honestly, just like random powerlifters that I would find on TikTok and Instagram.
Really, like straight to powerlifters? There wasn't
Straight to powerlifting.
Wasn't influencers first?
No.
Oh, that's interesting.
I would like on
So
my
who were they
TikTok
then?
For You page would come up with like it just random lay people like competing. And I was like, I want to do that. Like, I want to pick that up off the floor and like look cool in the suit.
That is one of the cool things about the visibility of powerlifting now is like when I started, it was only the elite that you would see on the internet because it was so long ago. Like you couldn't just post your training on the internet, post it visibly because, you know, Instagram was like barely around when I started. And now it's so much more accessible to so many more people because there's people of all shapes and sizes on their phone, like in front of them, visible. And it's much more relatable. So it's much more likely that people are going to come across it and go like, oh, that's cool, I could do that. Whereas when I started, it was like juiced up dudes squatting like 400 kilos. And I was like, ugh. And that actually like turned me off powerlifting initially. Like I would have competed way earlier had it been like, you know, visible like it is now.
Yeah, definitely. I mean, like that's how I started with Chrissy, was actually looking up like Sydney powerlifting coach and then like scrolling through them all. And I was like, I think I'll start with a female because, you know, like I'm a female. And then I was like scrolling through, you know, I saw Beck Chambers and like all of the people in my local area. And then I was just scrolling through Chrissy's content and I was like, I relate to this person. I want to be like her. Okay, let's reach out. And the rest is history.
Very cool. And then you started with me when Summer was born and Chrissy went on maternity leave, and
yes,
the rest is history. Let's actually talk a little bit about your lifting before we get into the physio stuff.
Sounds good.
What's been the highlight of your lifting career thus far?
Ooh, as in like a moment?
Anything.
I think growth from where I started to now as like a holistic thing, but also just each competition seeing how much better I am with my mind. And I know that sounds like kind of weird, but I know you remember that I had a full-on meltdown at I think it was our second comp together because I failed my third squat on depth. And I actually bawled in the car park. And I was like, I'm not built for this.
Well, you actually you didn't just ball in the car park. You actually just disappeared for like 25 minutes. And I was like, okay, Claudia's upset. Like, I'll leave her. And then it was like, okay, it's pretty close to needing to warm up for bench now. And then I'm like, okay, we definitely need to start warming up for bench now. And then it's like, okay, we should have started warming up for bench 5 minutes ago. I'm trying to find you, calling your boyfriend. Like, where the fuck's Claudia? Anyway, we got it done in the end.
Yeah. I was consoled by a few members. But essentially, yeah, I think the highlight for me is then from that coming to nationals this year. And even though I don't think it went as we planned, being able to overcome missing 2 squats and then go 3 from 3 on bench and deadlift and not be so kind of like emotionally attached to it and still perform to a standard that I was proud of, even though I, didn't execute to the standard that I should have on the day.
Yeah, I think that growth from being able to just go like, okay, that thing is in the past. Now it's time to move forward. Like, that was a huge difference from every comp that we've done together. And even like in training, if something goes not the way that you wanted to, you're able to just like move on now a lot better, which is great. I was totally expecting you to say your 161 deadlift.
That would be definitely probably one of the most euphoric moments I've had.
Yeah, that was cool. And the cool thing about it was that it only stood for like a minute. Did you end up getting a certificate? Did they send you
No,
one?
I didn't get a cert.
Oh, they didn't send you one. They should have sent you one. Anyway, you
AKA.
had the record for like a minute, and then you're on the podium for like a minute, and then you lost both in one lift. And anyway, you did great.
Next year, hey?
Yeah, next year. Actually, talking about next year, what are the plans for you for this upcoming comp and then next year?
Well,
I already know this, but you can tell everyone else.
Currently, our plan is to attempt to cut into the under 52s for the local part of the SBD Cup, which is in October. And the aim would be to A, make weight, B, qualify, and then C, go to nationals and try and win nationals in the under 52s.
Yeah. So a little bit of context here. It's the last year of Claudia's junior career next year. So her last chance to go to Worlds for probably a while as she enters Opens. It's obviously much more competitive in the Open division. So we figured that the 57 is quite competitive. There's a little bit of a gap in the 52 for the lifters who are left next year, who are still juniors. So we figured the chances of us winning nationals and being able to go to Worlds at 52 is much higher than it would be at 57. I still think there was a chance that you would have been able to win 57 and go to Worlds at 57, but you are fighting with many more girls, and it would have been like, a smaller chance than it would be in the 52. So the plan was to just do a bit of a cut. You've been like trying to gain weight for like 3 years straight, basically like 3 years straight of gaining weight. So, doing a cut to either see how you perform and go to 52, which it's looking like that's the way, or just like kind of lean out a little bit and then allow you more time to build into 57 for like a lot longer. That's kind of the plan.
Yeah.
So, yeah, exciting stuff.
Yeah.
So we'll get into what I actually got you on the podcast to talk about, which is some physio stuff. First of all, what actually made you want to become a physio in the first place?
Bit of a funny story because I didn't actually pick my physio degree until the day I got my ATAR. The entirety of year 12, I had convinced myself that I was going into the performing arts world. So much so that I had auditioned for American schools and every single performing arts school around Australia until I did the auditions. And then I was like, wait, I actually really don't like this toxic environment. It just didn't suit my personality type. I'm quite like sensitive and friendly.
I don't think you're very sensitive.
I'm not as sensitive now as I was, but like it's a really tough gig to be out there, and it's not the life that I wanted to live. I have other aspirations in my life than just to live my life doing performing arts.
It's also like so hard to make it.
So hard.
So competitive. There's that many people. And the difference between like the top where they make millions of dollars and then like the level below is like 20 times in terms of income. So it's like you can kind of like scrape it out and like just get by, or you make it and you're like a millionaire.
Yeah.
It's like a very low chance of actually like being properly successful.
It's
like-
more
like-
about the performing arts, Alex.
It's like going. It's like it's like going into trying to play professional sport. It's like if you can make it all the way to the top, it's like absolutely worth it. But for most people, like you don't get that far.
Yeah.
I know everything about everything, Chris.
I know you do, but
It's actually funny because you actually know everything about everything, and it blows my mind the shit that you remember, Chris. And I love that you have a microphone now. Yeah.
But
Yeah, you keep
wait, I've lost train of thought. Oh, why did I
going. Yeah,
become
why
a
did you
physio?
choose physio?
Yeah. So essentially, I realized that was definitely not the path for me, and I always loved being around people, and I wanted to really help people. I didn't want to try to do medicine, purely because my dad, who's a doctor, told me not to. And I'd always been obsessed with like how the human body moves and works. Like it just had always fascinated me. So then, yeah, when I got my results from my HSC, I was like, whoa, I can do this. So I put it down and then I got in and yeah, the rest is history.
So you, after you graduated, you went into a like grad position at a clinic.
Yes.
Tell me about that experience and what led you to end up sort of, I guess, running your own clinic here at the gym.
So I think there were a lot of positives, getting to, work inside a clinic and see how that is run, but also learn from a multitude of like senior physiotherapists. That was a very valuable experience, and also being able to have access to seeing, like I was seeing 60 patients a week. And I don't think I would have, I don't think I'd have the confidence that I do now to see people without having had seen 60 patients a week for that long, because you only learn as you go and as you see people and as patterns develop and as you see people get better with certain treatments, and that's just something uni can't teach you.
It's the same with coaching, really. It's like you can learn all the theory that you like, but until you actually have to apply it, it doesn't really mean anything, and it doesn't really click without having that experience as well.
And with coaching and physio, it's in the kind of realm where you do develop your own style. And that's what makes you unique, whether you're a coach or a practitioner. And you are only going to develop your style based on your interactions with your clients. And so, yeah, that was the positives. And then I think what led me to opening my own thing here was I had a lot of like dissonance with the financial side of running a business. And I really struggled with picking money over patients, essentially. I really like to see patients for 45 minutes. I want to understand what is going on, understand their story. I don't want to rush them. And so, yeah, I think the only way to do that was to kind of do it myself and give the service that I thought people deserved. And yeah, because I'd been doing strength coaching and running my own thing for like 4 years before that. I had some experience on how to get a business up and running, so I guess that helped. And also having that face-to-face kind of coaching interaction also helped.
And you also like had a bit of coaching on the side as well to supplement income while you were like trying to build it up anyway. You weren't going from like a full-time salary to earning $0.
Yes, exactly.
Yeah, you had that like kind of to fall back on. What other issues were there? Because I know there were more. I want you to talk about the other ones, because there was more.
talk shit.
You don't have to. You don't have to say the name of the clinic. You don't get in any trouble.
Flexibility with hours. I was doing illegal shifts and not being paid legally.
That's not good.
Yeah, and just no flexibility in terms of requests I was making, and I was severely being underpaid for the hours I was doing. And when I asked to change my hours, because I was doing a 12-hour shift, you're only supposed to do 10 under the health award, I was told no. even though I was seeing patients back to back for those 12 hours, and I had said, I'm burning out, I'm quite an energetic practitioner, I need like either more breaks or I need to do shorter shifts, because physically and mentally I was so fatigued to a point where I was like, I'm not coping, I'm burning out, and I love my job, and this is not how I want to go out. So yeah, after nationals, it was actually after we'd been away for 4 days in Newcastle, I was like, oh my gosh, I'm actually living my life. Oh, and on top of that, I was told no to leave for nationals because I worked on Sundays and paid standard rate. And I gave them 6 weeks notice, and they were like, no, you have to find someone else to cover your shift. And so I then had to work after nationals, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday, because my colleague covered Saturday and Sunday.
Wait, are you telling me that a recent graduate was exploited?
Dun, dun, dun.
That's crazy.
It is crazy. I'm glad you have a microphone, Chris, again. All right. So let's go. No, I am actually. So let's go into some powerlifting specific physio stuff, like which is kind of the main topic of this podcast. Yeah, so what are some of the most common injuries that you see in powerlifting?
I would say not so much like the most common injuries, but the most common pain sites, because I feel like that's actually easier to describe without going into a full rant about pathophysiology. Would
You can
be
do that if you like.
We'll be here a very long time, Alex. Anterior shoulder, so like frontal shoulder pain. Usually,
Who's had that?
huh?
Who's had that?
Oh,
Certainly
want-
not me.
You've had all of these. Whatever she says, you've had it, Chris.
I think everyone in the gym is currently like downstairs doing their shoulder rehab exercises. And that's usually because your pecs and lats are very strong, and they're both internal rotators of the shoulder. And so we become very fixated in one position, and we actually need to train the opposite. Usually our pain receptors get quite grumpy with us if we are too much towards one end of either range of motion or strength. And it's just our body trying to say, hey, tissues aren't happy with this. We need to change. That is what pain is. So whether that's actual structural tissue damage or whether it's the potential damage that's about to occur, it doesn't matter. The rehab is the same. And the only way we're going to know if it's actual structural damage or if it's just potential damage is a scan, and usually it's not going to change anything except money out of your wallet anyway.
And will scare you.
Yeah, exactly. And there most likely will be findings that have nothing to do with your pain anyway. Like when you got your shoulder scan, that was hectic.
Yeah, I had several issues.
A lot of issues.
Still do.
But again, like even in that shoulder, what was causing your pain was probably not every single one of those things
Correct.
that they
Yeah,
found. There
that's
would have
right,
been normal degenerative changes there, whether you were powerlifting or not.
Yeah.
Or whether you had pain or not.
Yeah. So yeah, anterior shoulder. What else?
Lower back.
Yep.
Not so much anything like, oh, I've broken my back, but load management with backs, fear of flexion. I actually find a lot of time, particularly with powerlifters, is they actually just lose flexion range of motion. They bias extension a lot. And when they lose that flexion range of motion, that's actually what pisses off their back more than anything. Rather than, oh my God, I rounded my back on a deadlift and now my back hurts. I've bulged my disc. Like, that's not what happens.
Yeah, I think that's why I've never actually hurt my back, is because I have so much flexion range and no extension range. I'm just like stuck in my deadlift position.
Well, you saw my reel on flexion.
Yeah.
It's just, a very debatable topic in the physio world, and a lot of older physios will probably disagree with me, but that's okay.
What's the old take?
Rounded backs, or whenever you are rounding your back, is a mechanism to disc bulging, posterior disc bulges.
And what's your take?
Flexion is normal human movement, and the only evidence that says that was done on dead sheep and pigs, like dead animals' spines, and they had to be flexed like 80,000 times before the disc bulged. So to me,
not very recreatable in the human
I think
world.
load management is much more important than avoiding flexion. Plus, when you go pick up something off the floor, are you actually doing it with a neutral spine? Probably not. So you may as well load it.
Trying to. I'm actually not trying to.
No, please
A
don't.
lot of people are trying to.
Please don't.
Okay, so how do we mitigate risk of injury in general? You mentioned a couple of things. I've jotted down a few things. Number one, load management. Let's go into load management a little bit. What's your kind of definition on what load management is? How do we use it to our advantage to mitigate injury risk?
I think load management is quite contextual in the sense of it's going to be different for every person. So whether that be, training is high on your priority list, and so you do have other recovery kind of strategies to help manage load, I think that needs to come into consideration with load. So whether you're sleeping 3 hours like Chris,
Yes, I'm so glad that I'm not the only one giving Chris shit.
Fuck this.
or whether you're sleeping 9 hours most of the time right now. I don't know about Bubs.
Me, yeah, I'm pretty good.
9 hours.
8 hours, yeah.
8 hours like Alex. Like, load management's going to be different for someone who is sleeping more and fueling themselves well and staying hydrated, and they're educated and proactive about that. Sorry, Chris just put his hands up in the air as if to say, fuck this. He doesn't do any of those. But he's trying. He's trying.
I think with load management, the thing is, like, there needs to be some sort of consistent baseline. When you get recovery, in a huge steep decline or training load in a huge spike, that's when we start to see issues. When there's only small changes up and down, we never really tend to see issues. But the great thing about having a baseline is that it gives us something to change, and it also gives us like a known quantity. So if we know that someone's doing like, roughly 6 sets of squats per week, and then all of a sudden they do 15, like that's probably problematic, right? And instead of like, okay, if 6 sets of squats a week starts to become an issue, like, okay, let's go to 4 and let's see what happens. So like that's a way to kind of manage load, is just to actually know what your baseline of load is, what your consistent level is.
100%. But I would also say with that is that not ignoring like niggles that do come up at that point. So why can't you squat 6 sets a week? Like, why? What's going on? And do you need to see a physio? Do you need to talk to an exercise physiologist, or do you need to talk to your coach about it? Because finding the underlying cause for actually why is whether are you just under recovered, or is there something that needs to be addressed now? Because as you continue to overload yourself, which is the process, right? It's going to come back up.
Yeah. And that's so common with people who have like a very slight shift to one direction in their lift, whether they bench slightly to the left, that left shoulder, that left pec is going to get a little bit more overloaded than the right side. And that's when you're going to see those niggles pop up. So that's when we can kind of like go back and look at technique and say, okay, how do we actually offset this and even things up and get even distribution amongst the pecs and shoulders?
100%. I think that's actually how I treat most of the time. I think tech changes is probably the last thing that I look at. I'm least inclined to do tech changes. It's definitely like last on my list.
That's something that I actually want to talk about. I didn't write that down, but an issue that I've had with physios who've worked with clients of mine in the past is that they're too like gung-ho with trying to change my client's technique. And I'm okay. Like, I'm actually open to any changes as far as programming goes, as far as technique goes. Like, I'm open to most things if you can explain to me why. Like, if you can give me a compelling case for why we should make a change, I'm all for it. The issue is there needs to be some sort of collaboration first. It's like the physio needs to reach out to the coach and say, hey, I've noticed your client does X, Y, and Z. Is this something that you'd be willing to change? I'm thinking that, what A, B, and C would actually be a better option. And I'm much more likely to be like, yeah, cool, like, let's try that. And then we're on the same page. Whereas I've had clients who go and see a physio and then they come to training and they send me their squats and they've completely changed the way they squat. And I'm like, hang on a second, like, where did this come from? And there's no like communication back and forth with coach.
I think that's where like being a coach myself has actually come in handy, because I know actually how frustrating that can be. I have had prior to when I was an accredited physio, I had a client go to a physio who told her she had FAI, didn't get a scan of femoroacetabular impingement, which is like bony growth at your hip.
That's what Thomas has.
Yeah, and was told she'd never be able to deadlift or squat in her life unless she got it shaved down in surgery. And I told her to never go back to that physio. And guess what? She's still squatting and deadlifting, and she's still PRing, and she's in no pain.
Then again, there are people like Thomas who've had like 4 hip surgeries and need another one.
Everyone has a unique,
But he
Wait.
also
unique
he also
circumstance.
squats like 400 kilos equipped and like
Was that
330
done?
raw
Was
and
that diagnosed without a scan?
Yeah.
Okay, so what?
Yeah. Yeah. But yeah.
Yeah, so some of the other ways we can mitigate risk of injury, proper warm-up protocols. What do you tend to recommend people do before jumping under a barbell?
Sorry, I'm laughing because I don't think I've ever seen Alex do a warm up in his life.
Yeah, just do
until
the
this
bar. That's
shoulder.
my warm-up. The bar, 70, whatever's next.
I think again it's contextual. Like everyone's going to be slightly different. Have you had niggles or pains before? Do you need to be doing some sort of prehab to offset any injury risk?
Never, no. What about you, Chris?
No.
Says the 2 people who I've both treated multiple times. Meanwhile, I'm here in a caloric deficit and I'm still not injured. Hey, touch wood.
Great coach.
Yeah, he's all right.
What about sleep and nutrition? Like, do you ever give recommendations to people? Like, is that something that you actually ask? Like,
100%.
because that's usually the first thing that I'll say to my clients. Like, oh, hey, this has popped up. I'm like, all right, well, how's your protein intake? How's your calorie intake been? How's your sleep been? Like, that's the first thing that I'll usually ask.
I'm not usually asking about like caloric intake per se, but in every single like subjective of an initial consult, which are usually like 45 or 60 minutes, I'm doing a full screening of their entire lifestyle. Physio is a lot more than, hey, my elbow hurts when I bend it. It's, okay, why is your body sending off pain signals and how can I help you with that? So I guess my approach is a little more holistic than your standard physio, but I think that's important because if I was just to look at your elbow, then your elbow's probably not going to get better very fast.
Yeah, I mean, we see this like in coaching as well, that coaches who have a very narrow lens of which they see things through don't tend to be able to solve problems that are broad, because like if your only method of giving advice is through a program, or if your only method of giving advice is through the technique lens, or if your only method of giving advice is through the nutrition recovery lens, like you're missing out on the other things. And I think like this is so true with physio, probably even more so true with physio. It's like we treat the thing, oh, it feels better, cool, go away. Or like do these exercises that are targeted very specifically and then like piss off.
Yeah.
Like that's so common.
Yeah.
Cool. So when we actually see someone, when you see someone, how do you decide on a rehab plan? Like, how does that plan develop?
Again, how many times have I said this on this podcast? Contextual, but so it's, if I'm saying like let's say it's a powerlifter, for example, yeah, it'd depend on whereabouts they are in terms of their training. So like, are they peaking for a competition? Because that's going to be very different to if someone is just chilling out doing some more off-season, quote-unquote, training. And that's going to determine kind of like a timeline of, okay, we desperately need them to get better, or we can let them keep training and get them better over a certain amount of time. But what exercises usually I'm giving are kind of to... I guess, promote the changes that we've made, firstly, in manual therapy. So I am not a hater of manual therapy, but I'm also not, it's not going to fix you. The exercise will fix you. The manual therapy will help you get range of motion back that you potentially didn't have before. But it's also going to regulate your nervous system in the way that you are experiencing pain. So if you think about it, when you kick your foot on, or like your shin on a coffee table, right? And then you go and rub it to make it feel better. It's the same thing with massage, dry needling. It's called gate control theory. Essentially, it's just tricking your brain into thinking that you feel okay. So yeah, exercises are usually aimed to keep that range of motion or continue to improve that range of motion that is missing currently. So usually in an injury or pain site, there is a reduction in some sort of range of motion or a reduction or huge imbalance in strength between a certain muscle group. And so retraining that in combination with manual techniques is usually the approach I go for.
Cool. So I guess you do the manual stuff first. You figure out whether that actually has an effect,
Yes.
and then you kind of like extrapolate that out into an exercise program. Is that kind of the way? Is that a good way of summarizing?
Yeah.
Cool. So how do we know that what we're doing is working?
Retesting, but also pain levels, right? Like if I am seeing someone and I treat them and they do their exercises, if we reassess range of motion and it's improved, that's good. Okay, let's get them under a barbell if that's when they were experiencing pain. Do they still have pain? Is that pain out of 10? Is it less than when it was? So I always ask someone on an initial consult, what is your max pain out of 10 and what's your minimum? And I usually use that to track whether people are improving, but also, just range of motion and strength testing and personal subjective things. But it's always nice to have kind of objective data as well to show a patient, hey, look, you are getting better. And I know sometimes rehab can be frustratingly long, but these are the numbers and these are the stats that we have to be like, hey, this is working. Trust it.
Yeah.
Trust the process.
And rehab's particularly frustrating in a powerlifting setting because we're constantly training. Like we're constantly doing the thing that pissed it off, and it's not just going to magically disappear. Something that I've noticed with my own aches and pains over the years is that it's very up and down. Like I have good weeks and bad weeks. How do you explain that? Like how do you explain the good weeks and the bad weeks?
I think that comes down to like what we were talking about before as well. Like there's so many other factors outside of whether you did your rehab or not to why you might be experiencing pain. And it's same with like training. Sometimes you have bad training weeks. Sometimes you have bad training days, but it doesn't mean you're not going to have good training days. Average training days happen on average, right? It's the same with rehab. You're going to have average days on average. That doesn't mean that if you have some bad weeks, it doesn't mean that you're not going to end up having good weeks, as long as the overall trend is you are getting better.
So I guess it's the ability to zoom in and zoom out.
Yeah,
Like
big picture.
zoom in on that particular session, give your pain ratings, give your RPEs, whatever, and then zoom out and see what that looks like in the long term.
Yeah.
Excellent.
Hang on.
Last thing on that was, how long do we give a certain protocol a chance to actually work before either continuing it and knowing that it's working or scrapping it and trying something else?
I would say with actually most things that I see, you do see some sort of instantaneous improvement in the first session, whether that be pain levels, whether that be range of motion, but the treatment that you're doing should have an effect when you first see them. Otherwise, you're probably not on the right track. In terms of long term, I mean, I haven't really run into a whole heap of cases where like things haven't worked at least a bit, but usually they evolve and develop and you need to progress or slightly navigate a certain way in terms of trying to offload certain tissues. But yeah, I don't think you can actually put a time on it. It's more, okay, is this person still in pain? Is there no improvement? Because I think on day one, or at least in a week, there should be some sort of, even if it's really small.
So you should almost know right away whether something's going to work.
100%. I mean, you're going to have anomalies in that. But most of the time, I'm seeing someone, they're going, oh, that feels better. Even if it's a 0.5 or a 1 out of 10 better.
I thought it might be a good idea. I just had this thought to go over my particular rehab case.
Yeah.
And just talk about when I first came to see you, what the issues were, how you diagnosed the problem, how we then collaborated with Matt for the technique, and what the actual issues were and how we fixed it. Do you want to go into that?
Yeah, it was quite complicated, actually, wasn't it?
I think that would be good.
Yeah.
So when I first came to you, I was like 6 weeks out from competition.
Yeah.
And left shoulder pain.
You just come back from New Zealand.
Just come back from New Zealand. Left shoulder pain, went benching. Pretty much only at the bottom of the descent and just off the chest. And it would be worse with load, like considerably worse with load, but I could feel it like with 70 kilos straight away. So what was your initial thoughts and diagnosis, and how did we kind of get me on the right track?
Well, I think, Chris, do you want to say something?
Is that not normal?
Wait, it's not.
I think also, for context, you did have right shoulder pain before. So it's
Sure
not
did.
just looking at the shoulder, it's looking at the entire, what we call scapulohumeral rhythm. So how your shoulder blade moves with your shoulder and what your thoracic is doing, because that could shift side to side. And you'll see with Alex, he is very, what we call depressed, not actually emotionally.
That's just Chris.
Fuck off.
But his shoulder blades are very much in a stuck and depressed position. He doesn't have a lot of upward rotation, and he does have a lot of thoracic flexion. That's because he's a bit of a deadlift specialist. So he was very much stuck in a position with not a lot of movement. I remember when I first treated your shoulder, your rotation was like 5 degrees.
Yeah, internal.
Both.
Yeah.
No, like both. You were not moving.
I move good now.
You move good now because it's been a
We
lot of
fixed it.
work.
Yeah. So what was some of the soft tissue, dry needling stuff? What did you do, and what was the goal of that and the outcome of that?
So essentially, we diagnosed Alex with subacromial impingement, plus or minus, some labral tear involvement. Regardless of diagnosis, it wasn't going to change kind of the treatment plan. We did lots of needling of Alex's lats, a lot of mobilization work into external rotation, internal rotation, scapular mobs, just lots of release work to try and get more upward rotation of your scap, to try and decompress your subacromial space. So if you think about it, like your arm bone, if it is sitting a little bit forward, there's lots of structures at the front, and you are constantly going to pinch them at the bottom of your bench press if you are in a certain degree of, like, a certain angle, particularly with just the way that you're built. So we did all of that manual work, and then you were on and off with the rehab that I was giving you until what? I think it was like 4 weeks out, and you were here, and you benched 140, and you were going to quit.
I was so sad.
Do you want to elaborate?
I felt like Chris.
I bench so much more than you. Fuck off.
That's fair. I had 140 for a couple singles, and they all felt like so pain, probably like 7 out of 10 pain, also just felt like I had no stability or control, and I was literally ready to throw in the towel.
You were.
I was actually like as close as I've ever been to pulling out of a comp.
I thought you were.
And that was kind of my my moment that was like, all right, either I'm a quitter or I can turn this around. And then
you were acting like this was 1 minute.
No, that was
There
like,
was
You actually told me you were quitting.
no, that was like
You're like, I can't do
There was
it.
like a
that was like a
24-hour
3 day.
period
No, it was like
of
3 days. It was like 3 days.
Yeah, of
And
Matt, myself, Chrissy, John, like everyone being like, Alex, you can't quit, man. You've got to like.
Yeah, I wasn't actually gonna quit. I was just gonna push the comp back a few weeks.
Yeah.
Anyway,
It's quitting.
and then I had this kind of like overwhelming support from everyone being like, nah, you just gotta do what you can do, and maybe you'll get your bench as good as it can be by competition. And then that was kind of my trigger to twice a day rehab.
I think the buy-in was then I collaborated with Matt. So Matt actually reached out to me first, being like, Alex is going to pull out. Can I give you a call? Like, what can we do? Talk to me. And I was like, look, if he's still getting 6 out of 10 pain, he firstly hasn't been super adherent to his rehab, but secondly, there are some tech changes that we can make. And like I said, it's not my go-to, but given this has been an ongoing chronic problem for you, it's like, can some tech changes actually offload these tissues that are chronically overloaded? So then I proposed to Matt just some ideas on how to offload the space that was really pissed off at the front of your shoulder for your bench press. And then Matt was like, okay, I've got a call with him in 40 minutes. I'll give it a good go. And then I think you guys had a call, and then you were like, okay, do you want to
Well,
go on?
I think Matt was like, don't decide just yet. Like, we'll catch up on the weekend. Matt came to my place. We did a technique session. He was like, I want to see if we can get like a good response with the new tech straight away. And we did. I bench 150. It was like 1 out of 10 pain, which was like
Huge.
night and day difference from the Tuesday. And that was kind of like, all right, we can do this. And then it was twice a day rehab, and it was new technique, which has been going well. Haven't had any issues with my shoulder since.
And
Describe
I think I was
what
treating
the-
you twice
sorry.
a week. I think I was treating you twice a week too.
Yeah, you treated me twice a week for like
Yeah.
3 weeks. Yeah,
Yeah.
before comp.
Well, it was
yeah.
just like get you to comp.
Yeah, and then since comp, like obviously the intensity dropped a lot, which that was the biggest issue. Was when the intensity got up there, that was when my shoulder was screaming. So the intensity has dropped off a lot because I'm doing a lot of rep work, and I've had absolutely zero issues with my shoulder, and I haven't even had any treatment in a few weeks. And I also have only been doing my rehab like every second day. Sorry.
Every second day I'm okay with.
What were you gonna say,
As
Chris?
long as you just don't stop doing them.
Yeah, I will. I'll keep going.
Describe what the actual technique changes like involved.
Yeah, okay. So the biggest thing was to get me out of depression. And in order to do that, we wanted to kind of like open me up a little bit, get me into a bit more elevation, a bit more elbow flare, which started off at the hands. So the first thing was the internal rotation at the hand, which kind of kicked my elbows out, which allowed me to kind of elevate on the way down a little bit, as opposed to being like down and stuck. Which meant a little bit of a higher touch point. It meant sort of a more open kind of rib cage, more like open pecs. That was pretty much it. So like sort of, but it's pretty much 3 changes. It was like the hands, the elbows, touch point, and then I guess that led to a little bit more elevation. Yeah.
Because if you think about it, the shoulder joint, if it's slightly further up and not being pulled down so aggressively, those structures at the front aren't going to get pinched in the process.
Yeah, and because I have quite long arms and pretty bad thoracic extension, when I was tucked, I would get to the bottom and then I would sort of like jam it down. Like my shoulder would almost change position right at the bottom of the press, and that was when it would start to cause that jamming. So now I'm like able to sort of hold that elbow position the entire time.
Yeah.
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 Cool. Well, I think that'll probably wrap us up. I do have a client now, and you guys have to train.
You'll have to train
Oh,
later.
I got
too,
15
dude.
minutes. The last question I had for you, Claude. I thought it was 2:30. It's 2:15. The last question I had for you, Claude, was I want you to kind of go into a bit more detail on this. What are the benefits of soft tissue work and dry needling? Like, what actually happens at the muscle and at the sort of joint to get things improving? Like, what's the actual mechanism?
This is a fantastic question. And unfortunately, the current evidence for all of these things is extremely wishy-washy. There is nothing definitive, but I can tell you what theories are around it. So manual therapy, well, not quite.
Not entirely.
Actually, like little bits, but manual therapy is not going to quote unquote improve your circulation. But like I was talking about before with like gait control theory, we do know that manual therapy has a huge role in regulating the nervous system. And for some reason, the way that if you think about our pain receptors, when you are in pain, they are going faster than usual. So it's like a ticking clock that is going at 2 times. And our job as clinicians is to get it to slow down to 1 times. That's going to reduce your experience of pain. That's what nociceptors or pain receptors are doing. They're just firing too fast. And so when we do things like trigger point release, manual therapy, it actually brings down any like heightened central nervous system. It allows you to relax, but also having that like physical touch can for some reason regulate those pain receptors to decrease your experience of pain, if that makes sense.
So that's the soft tissue work.
Yes,
specifically.
yes. But also, that in combination with exercise can then also improve range of motion, which could be something that could be contributing to your pain as well. So it's all very individualized. Dry needling, on the other hand, is also trying to achieve the same sort of thing. And the theory behind dry needling is that when we pierce the skin, we actually have a histamine response. And so increase blood flow to the area, increase white blood cells. That is going to then create a space of more nutrients for said damaged tissue to recover quicker. But also the nervous system comes into play then as well. You have broken the skin. That's actually like quite a pertinent thing to do. We don't do that very often. And your body freaks out. And so it starts sending everything that it needs to that area. So if you have something that is sore and then you pierce the skin near it, it's probably going to improve your rates of recovery, no?
Interesting. I've never actually thought about the mechanism. I just know that it works. Feels good, works. Doesn't really feel good.
Feels good sometimes.
Explodes and then it works.
If it's in your lat.
Hurts quite a lot.
Depends where you are.
All right, Claude, thanks for joining me.
Thanks for having me,
That was
Al.
episode 28. Next week, we'll be back with John Tran for all things SPD Australia Cup. Let's go. If you made it this far, I just want to say thank you for listening to Lift Talk. We are presented by City Strength HQ. And if you'd like to give us a follow on the Spotify or iTunes app, please do that. Like and subscribe on YouTube. And we will talk to you next week.